Sitting up in my room, had me thinking about you. I must confess, I'm a mess for you. Oh, hey girl, what's going on? I ain't see you. I ain't see you there looking at me, girl. What's up, everybody? Welcome to my channel. It's your girl, Just Spring, coming at you with another video. Feel free to hit the like, share, subscribe. On your way in, on your way out, on your way up, on your way down. Um, so thank you to all any new subscribers. I really appreciate it. Thank you for all the comments, the love, the hate comments, the shade, the whole tree, whatever, whatever you got for me. Put it on in the comment section. Um, so today, what did I do today? I went to go visit my aunt, if anybody cares. Uh, I mean, obviously it's my aunt, so yeah, she's in the hospital. She's not doing that great, but and my main thing is I just don't want her to suffer. Um, so we'll see what happens with that. Um, yeah. She has a daughter that has to fly back, that's been flying back and forth from Florida to check on her because the daughter is a registered emergency room registered nurse. So she can communicate very well with the hospital staff and the doctor. Um, so come to find out, yesterday, my cousin, the oldest sister, had an issue because the nurse was acting funky. So they had to get that nurse together real quick. But anyway, because my cousin do not, both of them, but the nurse, she ain't playing because she know what it is, and the other one, you know, she ain't playing either. But the nurse, she gonna let you have it. So anyway, I did some laundry. I was sweating like a dirty pig in a pig pen. Um, and I went up to the shop to take my son to see his sister's shop. And what else? What else did I do? That's about it, really. It was just so hot. I mean, I was just so tired, hot. Came back home, cooked something to eat. Um, it's so hard not to buy something when you already out, but I like a home cooked meal. So I'd rather eat my food at home. But if I'm hungry and I'm like, being greedy and stuff, I'll end up, sometimes I'll buy takeout or whatever. And a lot of times I don't know what the hell I want to eat. So anyway, you know how it goes. Um, oh, I made some fried Oreos because I am such a fatty, fat ass. Made some fried Oreos that I had for the first time when me and a date went Soncerae Jasmine to live when I went on a date to the fair 2 years ago. I had them for the first time and I've been hooked ever since. So I looked up a recipe and hey, 1, 2, 3, it ain't that hard. But anyway, so I was doing some research because I'm so invested in these people's lives. I don't have a life. Um, none of us there's no professionals in the Viper Pit. I'm not a nurse. I just play one, you know what I'm saying? My check stubs and my nurser license, that's just, I bought that off of Amazon, just so you know. Um, I don't know what anybody does in the Viper Pit. I think there are a couple of nurses besides maybe I'm an LPN. I believe there might be some registered nurses in there. There's all kinds of professional people in the pit. We just happen to have time. Hey, it is what it is. Um, I cut back on working so much because I had um an injury. So I technically have more time. Um probably than most right now at this moment. So, anywho, um, and I'm not dating, so here I am. Oh, Shantae's got a man. But I think I am wanting a man now because you know what? I've been listening to like when I listen to music and stuff, certain music, I just want to do a two step with my man. But anyway, nothing. Never mind. I'm kidding. Okay. So today's lesson is we are going to look up cancer treatment, um, free cancer treatment to Californians. So Google says if you are diagnosed with breast or cervical cancer, free treatment is available to all all Californians who qualify through the breast and cervical cancer treatment program. Information on this program is available on Medi-Cal's website or call 1-800-824-0088. You hear that, Soncerae? To speak with an eligibility specialist. So they really don't need $100,000 from you people. So here we go. They have Everyone Counts Department of Healthcare Services, ca.gov. It says, does Medi-Cal cover breast cancer treatment? Okay. What benefits are available through BCCTP? Provides coverage for breast and cervical cancer treatment and services related to your cancer diagnosis. If approved for federal BCCTP, you may receive full scope Medi-Cal coverage, which is not limited to breast and cervical cancer treatment services. Okay. How do I apply for the for all the women's counts? Let's see. You can also call the EWC Consumer 800 number automated line at 1-800-511-2300 for 24-hour provider referrals. You may be eligible for full health coverage under Covered California. Okay. Let's see. What is covered under Medi-Cal? Medi-Cal covers most medical necessary care. This includes doctor and dentist appointments, prescription drugs, vision care, family planning, mental health care, and drug or alcohol treatment. Medi-Cal also covers transportation to these services. Okay. It was something else I had looked up. Damn it. How much money can you have in the bank and still qualify for Medi-Cal? You may have up to $2,000 in assets as an individual or $3,000 assets as a couple. Okay. Okay, let's look into this breast and cervical cancer treatment program. We're going to go into a little more depth. Okay. Breast and cervical cancer treatment program, also known as BCCTP. BCCTP provides needed cancer treatment to eligible individuals diagnosed with breast and or cervical cancer who are in need of treatment. New information regarding state-funded BCCTP as of January 1st, 2017. Assembly bill may grant an additional 18 to 24-month period of coverage with the recurring breast or cervical cancer diagnosis, regardless of cancer location, to state-funded BCCTP recipients whose original period of coverage has expired. Individuals with recurrence must meet all applicable eligibility requirements to receive an individual or additional period of coverage. Individuals with the break in services may have to reapply. Okay. Oh wow, look at this. Okay, what is the program? BCCTP provides cancer treatment and services for eligible low-income California residents who are screened by Cancer Detection Program. Every Woman Counts, their family planning, access care, and treatment, family pack program, and found to be in need of treatment for breast or cervical cancer. How do I apply? Enrollment is performed only through providers in CDP, EWC, and Family Pack programs. The BCCTP provides online real-time enrollment in provider's office. So, I mean, hell, you could go in the doctor's office and apply. For information about the CDP, EWC screenings, and who is eligible, visit the website. Okay. An individual may receive coverage through BCCTP if all the following requirements are met: have screened and been found to be in need of treatment for breast. Um, Women under 65, Kathy. California resident, Kathy. Have monthly gross family income at the time of screening and diagnosis, which is at or below 200% of the federal poverty level for family size, Kathy. According to Soncerae, you are PO. Have no other health insurance, including full scope, no share of cost Medicare or Medicaid care. Okay. Let's see. Okay, so what benefits are available through BCCTP? Provides coverage for breast and cervical cancer treatment and services related to your diagnosis. If if approved for federal BCCTP, you may receive full scope Medi-Cal coverage, which is not limited to breast and cervical cancer treatment and services. State funded BCCTP provides no cost services limited to breast and cervical cancer related services and reimbursement of insurance premiums under certain circumstances. Prosthetic bras are covered if a prescription is written by a doctor and taken to a durable medical equipment supply facility. So, how long can one get coverage from BCCTP? Federal BCCTP provides full scope Medi-Cal benefits for the duration of cancer treatment as long as the individual continues to meet all other BCCTP eligibility criteria. State BCCTP provides limited scope Medi-Cal benefits for breast cancer treatments, services for up to 18 continuous months, and cervical cancer treatment services for up to 24 continuous months. I'm sorry, I'm back to stupid. An additional 18 or 24-month period of coverage with a recurring breast or cervical cancer diagnosis, regardless of cancer location, to state-funded BCCTP recipients whose original period of coverage has expired. Individuals with a recurrence must meet all applicable eligibility requirements to receive an additional period of coverage. Individuals with a break in services may have to reapply. So, Soncerae has made it very clear and known to the world that her mother does not own property. She's never been married, so she doesn't have a husband's income. So basically, all she does is she watches Baby Boy and she runs around doing DoorDash. So in that case, Kathy would be more than eligible for everything in the book. Let's see. So prescription. I currently have BCCTP benefits, and I'm having problems with prescriptions. Okay. The pharmacy states that Medi-Cal will not authorize my prescription. The pharmacy or your medical provider must request a treatment authorization request. Your pharmacy or provider may. So that's easy. I mean, hell, you just contact the pharmacy, contacts your doctor, whatever. I received a bill from a medical provider, pharmacy, or laboratory. Make sure that Medi-Cal or your managed care health plan has been billed for these services. Medical providers, and pharmacies that accept Medi-Cal are responsible for billing Medi-Cal directly. If a medical provider states that they are waiting for authorization from Medi-Cal, they must contact their regional Medi-Cal treatment authorization request liaison. BCCTP does not authorize any medical treatment, diagnosis, exams, or prescriptions. Okay. Out of pocket payment. I pay for services that should have been covered by BCCTP. If you already pay for services that are covered by Medi-Cal, you should call the Conlan unit Area code 916-403-2007. So let's see here. I received treatment before applying for BCCTP. Will BCCTP cover the cost? You must submit an application to request retroactive Medi-Cal. And if you're determined eligible for BCCTP benefits, it is possible that Medi-Cal can pay the services you receive for up to 3 months prior to your application. So, interesting. So, say she got money from y'all Negroes, crazy Negroes out there. I mean, it's obvious that it's resources out here. Like, I'm glad somebody brought that up because I would have never even thought because I'm not really paying no attention. But this is so stupid. Like, it's all kinds of help out here for breast cancer. Okay, so say I do not qualify for BCCTP. Are there other health coverage programs or resources available? If you are not eligible, you can apply for insurance affordability programs through the Covered CA website. Covered CA's toll-free number is 1-800-300-1506. Other resources, this was I was looking up earlier too. Other resources not affiliated with Medi-Cal are the American Cancer Society, the Susan G. Komen Cancer Care Inc., or the Breast Cancer Network of Strength. So, Big Kathy and the rat are scammers. Get it? Scamming. Scammers. All right, let's look up another one here. Breast Cancer Solutions, California. California knows how to party. If you have been diagnosed with breast cancer, please call toll free 1-866-960-9222 for the following services. Screening, navigation. Now, what else should I be looking up? Treatment. Financial assistance, breast cancer angels. Currently assisting Southern California. Okay, so she's in NorCal. That's South SoCal. Every Woman Counts. The Every Woman Counts program provides free breast and cervical screenings. Okay, we don't need screenings, apparently. Every Woman Counts covers services. Was that the one that's in SoCal? Resources for living with a breast cancer diagnosis, Susan G. Komen. While our list of resources for people living with breast cancer is by no means comprehensive, we hope you will find it useful and welcome your suggestions for additional resources. Okay. U.S. Breast Cancer Resources. National Cancer Institute is the federal government's principal agency for cancer research training. This website has information for patients regarding prevention, treatment, screening, and coping with breast cancer. American Cancer Society. I think I just listed all of these. Breastcancer.org. Org's mission is to help people make sense of the complex medical and personal information about breast health and breast cancer. Okay, you got your Breast Cancer Action, Young Survival Coalition. Serves young adults affected by breast cancer locally, nationally, and internationally. Bay Area Breast Cancer Resources. Didn't she say she lived in San Fran? Supports anyone affected by breast or ovarian cancer with personalized services that inform and empower. All right, enough of that. Now let's ask this question. Google. Wait a minute. What if I have breast cancer in California and I need a ride to my appointments? Okay. American Cancer Society Transportation. Here we go. We have several transportation assistance programs all across the country can connect you with the best. If you or someone you love needs a ride, we may be able to help. Road to Recovery American Cancer Society. Every day, cancer patients need rides to treatment. Is not currently setting up or coordinating patient. What? Okay, let's see. Does Lyft give free rides for cancer? Your Lyft rides can benefit the American Cancer Society Road to Recovery program, which connects cancer patients with rides to treatment. After opting in, Lyft will automatically round up your ride payments and donate the difference. Um, let's see. How do I get? Um, Finding free rides helping cancer treatment recovery. Um,